The last two examples that you heard from Sam and Stuart were effectively examples where you see a care professional and there is some information about you in front of them. And obviously that requires the ability to identify you. I give you some examples of other uses of care where sometimes we have information about you where we can identify you, but more often we have depersonalized or anonymized data that we need. So example one, imagine you're eligible for a flu jab. Maybe many of you had one this winter, hopefully most of you. But some people don't get them, even though they could get them. Maybe they don't want them, or they just forget about it. So we have the ability to find you in the data, at least part of the NHS has, and we could send you reminders. We could send you a letter or a text message to encourage you to come. So that is what we call sort of preventative or supportive use of data to encourage you to take up care. The second example, which is one where we probably use aggregate data, is a lot of hospitals in London and elsewhere probably need rebuilding or refurbishment. And I heard some really interesting conversations on the tables already, because how do we know how many hospitals to build or what to put into hospitals? And for that, obviously, we need data as well. We need to know what services are likely to be accessed or needed, because we built them for many decades ahead. These hospitals are with us for a very long time, and knowing what we should build requires good data. And finally, the final example is research. So most medication that you take, most services that you use, in some form or shape have been tested somewhere previously with data. So most drugs are developed and require clinical trials to figure out whether they're actually safe and whether they work. And that obviously requires data. And we have, for example, just done or are in the process of doing a clinical trial for a digital health app. More of these interventions are now on your phones. So how do we know how these things actually work? For that, we also need data, and preferably longitudinal data, so data that tracks you over time so that we can see how these things actually work out. In your packs, there are a number of slides, and I won't go through this. For each of these examples that I've given you, there are some obvious benefits, but there are also some obvious concerns that you may have, and there will be time over the next few days to debate those. Thank you very much.